They said no one ever came back from the third floor. That wasn't a figure of speech, it was hospital policy. Staff joked about it nervously, like a superstition, while veterans refused to speak on it at all. But when Nurse Eliza Tran was reassigned to night duty on the third floor of North Cross Hospital, she realized something horrifying. There were patients up there, patients who had been declared legally dead. The hallway lights flickered too often, the records were sealed tighter than military files, and the sound of whispers echoed when no one was around. It didn't feel like a ward, it felt like a prison, a cold, sterile cage for the forgotten. Eliza noticed something wrong on her very first shift. Patient 302, Carmen Holloway, wasn't on any active log. No digital ID, no chart, not even a meal schedule. Yet every few hours, someone injected her with something from an unmarked vial. Her eyes, though open, were glassy, like she was there but not really. When Eliza asked about her, a supervisor told her to mind her assignments and not the ghosts. Ghosts, that's what they called them. But Carmen had a pulse. She had a heartbeat, and someone wanted her kept quiet. 2 weeks in, Eliza stumbled on a printed document left near the copy machine. A roster of names titled Project Continuum. There were over 30 listed, most with dates of death going back months. Some even had discharge summaries saying deceased. Yet Eliza had seen 2 of them in the hallway just last night. Breathing. Alive. Barely. Fear rooted itself in her chest as she read the fine print at the bottom. Trial status. Involuntary. Sedation required. Clearance. Level 6 only. She wasn't supposed to see it, but now she couldn't unsee it. Room 3F12 didn't have a normal lock. It had a steel slide bolt and required a badge she didn't have. The few times she passed by, she heard moaning low, inhuman sounds like someone choking on air. One night, a janitor slipped and dropped his cart, and the door cracked open. What Eliza saw inside would haunt her forever. A man strapped to a gurney, pupils dilated, skin pale and marked with needle bruises. His arms flailed weakly, as if his muscles were no longer his. And standing over him were 2 doctors in full hazmat suits, recording vitals and adjusting tubes. They didn't even look up, just said, "Close it, now." The nurses began to avoid her. Conversations halted when she entered rooms. Her reports were edited, her logs overwritten. Eliza felt watched, not just by the ever-present security cameras, but by something unseen, embedded in the walls of North Cross. When she confided in Dr. Avery, the only physician she trusted, he turned pale and whispered, "Don't say anything. They listen. Even now, the third floor isn't part of the hospital anymore. It belongs to someone else." He refused to explain. That was the last time she saw him alive. Patient 3F07, a woman named Margaret Delaney, grabbed Eliza's wrist one night with more strength than expected. Her voice was weak but clear. "They said I died in 2019, but I'm still here." Eliza's heart pounded. Margaret's eyes, wide and frantic, begged her to listen. "They test things. New drugs. Injections. Some people don't wake up. Others forget who they are. I remember everything. I wasn't supposed to." Before Eliza could ask more, an orderly entered. Margaret was sedated within seconds. That night, her name disappeared from the patient board. A man was brought in at 2:43 a.m. by men in suits, not ambulances. No family, no ID, just a barcode bracelet. He screamed during the injections, violent, ragged cries of pain, and then went silent. Eliza found his room the next day. His mouth was taped shut, his eyes open but unblinking. A soft machine beeped next to him, monitoring vitals, while a clipboard hung nearby with only 2 words written in red ink: "Do not engage." One night, alarms blared on the third floor. Code blue, patient down. Eliza ran, adrenaline surging. But when she arrived, there was no team, no code. Just 2 security guards standing outside a patient room, denying entry. Behind them, a figure convulsed violently, limbs flailing. "It's a false alarm," they said. "Go back to your station." But it wasn't false. That patient died within the hour. and their body never taken to the morgue. Instead, wheeled behind the elevator into the sublevel, a place not marked on any hospital map. Dr. Patel found her crying in the stairwell. He'd been at North Cross for years, long enough to know things he wasn't supposed to. With trembling hands, he passed her a flash drive. "I can't do this anymore," he whispered. "It's a partnership. Pharma companies. They use this floor for unapproved trials. These patients, most were homeless, addicts, undocumented. Easy to erase. Easy to lose in the system. And they pay the hospital to keep quiet." He begged her to get out, to go public. He died in a car crash 2 days later. His body was cremated before any autopsy. Eliza plugged in the flash drive. What she found was monstrous. Videos of patients convulsing during drug trials, internal emails between executives and pharmaceutical reps, signed agreements stating patients were test subjects rather than individuals. Most chilling was a spreadsheet titled "Expected Mortality Rate," with targets marked in percentages. Death had been calculated, managed, budgeted. North Cross didn't fail these patients, sold them. After submitting anonymous reports to the health board, Eliza tried to resign. Her resignation was denied. 2 days later, her apartment was ransacked. Her phone bugged, and then she vanished. No one at the hospital remembered her. Her credentials were wiped from the system. Surveillance footage of her last shift showed static. It was as if she never existed. Months later, a new nurse, Luis Mercado, was assigned to the 3rd floor. He found an old locker, unopened for weeks. Inside, Eliza's badge, journal pages, and a sealed envelope labeled, "If I disappear." As he read through her notes, dread seeped into his bones. The 3rd floor was still running. The same patients, the same silence. The numbers game continued. But now, Luis knew the truth. And once you know, you can't pretend. Hospitals are places of healing, but some floors are built for something else. For profit, for secrecy, for control. If a patient dies quietly and no one asks questions, did it really happen? Ask the families who never get answers. Ask the names erased from records. The 3rd floor of North Cross was never about care. It was about compliance. It was about experiments wrapped in sterile white sheets. And if you ever find yourself in a hospital hallway and someone tells you not to go past a certain door, listen. Some patients don't die. They disappear. Subscribe to the White Coat Crimes for more medical crimes and mysteries.